I'm Greg, and you're listening to Totally Preventable.
Totally preventable.
Totally preventable.
Totally preventable. Totally preventable. Totally preventable.
Totally preventable.
Ooh, high energy. That's what I can say about our next guest.
Absolutely.
Just ever since I was introduced to our guest, high energy is the phrase that comes to mind.
And passion.
And passion.
Yep.
And passion. Today, we are being joined by Jamie Lehane, the president and CEO of Newport Mental Health. And all I can say is buckle up.
Yep.
This is going to be a good one.
Lots of good stuff going on there. And Jamie always has all the information.
Yes.
Very passionate about what he does, getting stuff done.
You can't say anything about pretty much any behavioral health, mental health, pretty much any type of prevention work being done in Newport County and in the state. Jamie's involved some way, shape, or form. I just can't wait to. One thing I want to talk to him about is the Newport Mental Health reaction to COVID. I think that was more than commendable. It was. I
They
just
really
hear about that.
jumped into action.
Yeah.
Yep.
Right off the bat, and it was the only time that I had heard of anyone doing something like that. So I want to talk about that and so much more, especially that new hotline.
Yes.
988.
988. Or oh, never mind. Yeah, I was going to show the magnet, but never mind.
So without further ado, today joining us on the Totally Preventable podcast, we have Jamie Lehane, the president and CEO of Newport Mental Health, along with Dayna Gladstein, the executive vice president of Newport Mental Health. Thank you both. Thank you so much for joining us today.
Well, thank you for having us.
Great to see you both.
To start off, can we just learn a little bit about yourselves? Can each of you just take a turn and tell us some more about yourselves?
Sure. Dayna, why don't you go first?
Well, I'll tell you about myself by telling you about my job. It's just one thing for me. So I oversee all of the operations for the agency, all of the clinical programs, and I work for the people we serve. I'm a clinical social worker by training. I've been working in the administrative level for probably 25 years. And that's how I see myself within my role as an administrator, that as long as, and I tell my team this all the time, as long as we're completely focused on what's in the best interest of our clients, we can't go wrong.
Very true.
Yep. How about you, Jamie?
Well, I've been at this for about 40 years in the field of behavioral health. And I've worked, now this is my fourth state. I've been here at Newport Mental Health for over 9 years, going on 10. My passion has been to basically keep people healthy and happy that are faced with mental health and substance use disorders. And I've worked in most recently the decade before I came here in Connecticut, being the behavioral health director for the state's Department of Children and Families. And I was actually put in by a court monitor, kind of against their will, to put a robust, evidence-based, community-based mental health system for children and families so that kids stayed in their homes with their families and stayed in school and got the best evidence-based behavioral health practices. Before that, I probably spent over 25 years working in mostly urban settings. Washington, D.C., I was the director of their adult mental health system. And in Connecticut, I helped build the local mental health authority system, or CMHC system, and took people that transitioned out of state hospitals and actually built person-centered, recovery-based care for them in the community, and actually was responsible for, in part with others, to close Fairfield Hills State Hospital in Connecticut. And when I was in DC, we were right-sizing their state hospital called St. Elizabeth's. My passion is person-centered care, recovery. It's about the goals people come to us wanting help with, having same day, immediate access to care, because you guys are very well known. When someone finally has the courage that they need to get professional help, we need to be there, not give you an appointment, not have a waiting list. So those are all the things we're building here at Newport Mental Health. And you know, funding's a challenge. Everything is a challenge. So we're flying a plane while we're building it. But that's kind of my background. And I did run a little mental health center like this in Vermont for a while. And I thought, because I retired from my state positions in Connecticut, and thought this would be a nice little nonprofit, semi-retirement job.
Mhm.
But I have to say, we have worked harder, both of us, I share over the past years than we've ever worked in. More than you needed to know. And so wait a minute, the most important thing, I got 4 little grandkids, and my passion is that I'm a keyboardist, and my suppressed desire has always been to be a rock and roll star. So I play in a local band called Double Shot. So any 2 classic rock. Some of these songs I've been playing since I was in 7th grade.
Little shameless plug.
Yeah.
It's neat to know things that we don't usually find out about people.
Right.
Yeah,
I mean, will probably bump into Jamie at a an event or at a meeting and not even know that he's a keyboardist,
right.
in a rock band.
That's why we coined our fundraiser, our galas, Rock the Mansion, because I always get up and play at least one song. Let's talk about the really serious problem of homeless folks that are unsheltered on the streets of our communities in Newport County, often migrating to Middletown and mostly Newport.
Yep.
And I'm going to let Dayna talk about our recent experience, because the work Dayna has been doing with our team has really been hands-on on the street. I'll just say, I think people may or may not know that when COVID hit in 2020, in March of 2020, we had many people that were unhoused, and we were concerned that what would happen if they became infected with COVID. They have nowhere to isolate, nowhere to shelter. The emergency room, Dr. Anthony Napoli called me and said, "You work with this stuff, what can you do?" And so we stepped up, and I'm proud to say we were probably one of the only cities in the country that were able to offer emergency housing and get every unsheltered person off the streets. Often, these were folks that had been banned from our congregate care shelters.
Wow.
And my head almost blew up, because the emergency room said, "These people tell us they're banned from life from the shelters." You can't ban somebody from life, that's.
Right.
Well, it turns out these are the folks that are unsheltered, that are the folks that have the most serious, complex, often co-occurring substance use disorders, untreated substance use and mental health disorders. I mean, folks that have long-term chronic alcohol problems, polysubstance use, and of course then, drug-induced psychosis, just a whole. And not only do they have these very serious behavioral health needs, they have complex medical needs. So our staff stood up, beginning by I write a little column once a month in the local paper, asking for people to step forward and make some dedicated donations. And this community stepped up. They donated money for us. We started putting people in. We didn't do it ourselves. Dayna coordinated all of the groups that were working with and for people that were homeless. And we set up a kind of a collaborative system of care. We had calls with folks that like the Winters that do Newport Housing Hotline. They are on the street every day, engaging and building trust and putting together meager funds to put people in a motel for a night or two to keep them safe. So we were able to then build momentum, and we were able to get a lot of state funding because they saw what we were doing. And our secret sauce was not just to put somebody in an emergency shelter or in a room. What we did find out that when you meet people's basic needs and you put a roof over their heads, you give them a shower and a microwave, and you help them connect with food and basic needs, that these folks then started their behaviors that wouldn't allow them to even go into the McKinney shelter or the family shelter at Lucy's Heart. That they started to then kind of get some traction, and over time, because we were able to get the Department of Behavioral Health under the COVID emergency to allow us to do engagement over time, because it may take 1 month, 3 months, 6 months to build the trust and the relationship that we can now support for people into their first steps back into recovery and care. So not only did we house them, we built specialized behavioral health treatment teams that were dedicated. I'm sorry, I don't let anybody else talk.
It's all right. I mean, that was a lot of great information. And from that, I wanted to ask Dayna this question. As you mentioned, this was during COVID. How was that effort when everyone was just in this state of unknown? How was that effort to gather people to get these teams together to help find housing for the unsheltered?
So the community here in Newport County has a lot of very good organizations and leadership. And I have to say, under working with Jamie, it's amazing how he can motivate and energize, get folks interested in stepping up to these kinds of important issues for our community. So the interest is there, the appetite is there. It's just the bandwidth sometimes during COVID is really difficult for all of healthcare, behavioral health, social service agencies. And so we kind of took the philosophy of many hands make light care and all tried to work together collaboratively so that we could lift up this population. We believe in housing first, which is a methodology for delivering services to folks that are homeless, which is evidence-based. And we believe in low barrier access to care, and that everybody deserves a home and community.
You start where they are. No barrier was our philosophy to get people safe and start their journey to getting housed and getting help from where they start.
Yeah, and so it was really a challenging but exhilarating, if you will, experience. The staff here and the teams here were like street angels. I mean, the same person that was working at 7 o'clock in the morning doing one job was covering the hotel bed services that we had at night because the workforce was not increased. We had to use the same workforce.
And last year, we basically leased the whole Motel 6 in town near the Walmart on Connell Highway. And how many rooms were there?
We had 130 rooms.
Wow.
And they were filled.
Wow.
And, there were nights, because we're in a workforce crisis. We've got 60 vacancies that we want to fill here at Newport Mental Health. Our staff was stretched so thin. There were nights to cover the supervision in the motel. Dayna would go in at the front desk and bring her husband in because we just couldn't push staff to go one more night that night that they needed a break. But, what we learned is that these folks can recover, and we didn't do it ourselves. We had the winners, Newport Housing Hotline, MOK, Carmela Greer, who runs the Edward King Center in town, but also is the city's emergency man. She gave us hundreds, if not thousands, of ready-made meals. So this was a community team effort.
Definitely a community effort.
Now the issue is that this winter, it really is a crisis because we were not able to do the emergency motel full. We're using that when we can pull some dollars together to put families with children, because many of these folks were, and I don't want to give the idea that homeless folks all have serious behavioral health. Some people just need a goddamn affordable house. So I don't want to paint the picture that everybody homeless is disabled with serious behavioral health disorders.
I wanted to ask you, I heard that there were a lot of families with children that were unhoused. I guess it was last winter. And is that just due to not having affordable housing? And
Absolutely. There are parents or a mom with their kids who may be working 2 jobs in our hospitality industries, low paying jobs, but these aren't folks that are just, not trying to make it for their families. These are folks, and many of the people, even the folks with some behavioral health challenges, they're working, they just can't get enough money to afford the unbelievably high rents, and the housing stock is no longer here. During COVID, many of people came from cities like New York City and bought second homes here. I think the mayor, our new mayor, Cy, is just fabulous and committed to working in partnership with us and other providers. He says somewhere between 25 and 30% of the housing stock is unoccupied most of the year because it's a summer house. Then you put you put Airbnb in, that's eaten up many of the other rentals here. We got a crisis. So some of these folks, I have employees that come to Dayna and I that say, I don't know whether I can still work here because they raised my rent and I'm gonna have to find another place, and I think I can only afford to work off the island. I'm not sure I can commute. I mean, so this is pervasive, but again, I get carried away.
No, it's
passion.
and even, I mean, you hear it even in, when I asked the question about, you both to just let us know about yourself, that you're very client focused, as not only as an establishment or organization, but as individuals. What was it about, and I'm sorry to keep going back to this COVID thing, and you've mentioned how you were like one of the only cities in the country to be able to do what you did. What was it that sparked you to know, like, you know what, we have to take care of this community and we have to take care of it right now in a time where everything was just so uncertain? What was that drive?
Well, we've spent our whole lives committed to these works, to these folks that are in need. So, I mean, that's number one. Go ahead.
Yeah, I think that what I tell people is that everybody who's homeless has a different story.
That's right.
And if any human being that spent a day listening to a couple of stories of folks that are homeless, you couldn't turn your head away. So this organization hires people like us who believe that the folks in this community deserve a home. They deserve healthy, quality lives, and that it's really our responsibility to help them get there. Whatever it is that they feel is what they want to achieve.
In this community, many of the good people that have been working very diligently to help folks that are homeless, unsheltered, and have needs, they've actually given up on this small subset of unsheltered folks that have been on the streets. These are human beings, and they had been trying for decades to help these folks. And it's human nature to say, well, don't even bother with so and so because you're never going to get them to get into care for get him sober. We've tried for 10 years, but that's still a human being. And that's not usually not true. Like, if you really listen to the story, you find out that person, yes, they were sober for 6 months, and that tells me there's hope, and
there's
we can
hope.
build.
And we're going to build on that.
Right. but we burnt out our staff. Let me tell you, it wasn't without consequences. You know,
Yeah.
our caseloads went up on our treatment. It had impact on our quality. So when we came to this year is no better than the COVID years. In some ways, it's worse. Every shelter bed in our community here has been filled. There are no admissions because of the construction going on, which is wonderful at the McKinney Shelter, Cooperative Shelter, because they're air conditioning them, they're renovating that building, and it's going to be there for affordable housing and as a homeless shelter for decades to come because of the work they're doing to kind of fix that place up and finance it and move it forward. McKinney, Lucy's Heart, they've been filled because they only have so many family apartments, and they've been filled. So what was going to happen? We estimate, because Dana's been out there on the street doing our point of time surveys about how many folks are here that are unsheltered, and we estimate 25 to 35 individuals, and then what? About 7, 8, 10 families. They predominantly live in their cars because they can turn the heater on in the winter as long as they have gas money. So we, together with the other providers and particularly the mayor, our new mayor of Newport, basically got together and said, we don't even have a warming shelter at night. So Dayna really took the lead on this. And the first cold snap, which was February, the first weekend in February, Dayna and our staff, in partnership with the city, got the Maritime Museum Center down on Thames opened up. The leadership of the mayor brought the fire department, brought the police department to help staff that with our staff. I paid double time, so we didn't have funding for this, so it hurt. But it had to be done. And that's who our center has always been, way before I came. If there's an unmet need in this community, we can't turn our heads.
Right.
And our board didn't want us to go back into the homeless shelter business and stuff, but we went to them and said, people are going to die of hypothermia this winter. We got to do something. The good news is we're good at writing grants, and we're good at bringing people together. And Kodak has stepped up to staff an ongoing warming center. We've got Church Community Housing has allowed us to use their downstairs room in their base. So we now, has it started? Tell us about it, Dana.
Yeah. So we have a temporary warming station, as they call it, the new lingo for warming centers, in the basement of 50 Washington Square. It usually has between 2 and 5 individuals that stay there every night. And we'll be keeping that open, hopefully, if the funding comes through, until the end of March. We're also working with the other organizations to not have a temporary warming center next year, but to actually have a permanent warming center. And so there's several organizations that are working together to find the space, the staffing, the funding, and I believe that will happen. We will have that for next year, so that we don't have to have these pop-up,
yeah, I mean, this has just been a scramble, and so we've talked to the mayor who's on board. He is just breath of fresh air here. I keep saying that, but he's gone up to Providence, to the legislature. He's met with the new housing secretary, Stefan Pryor, and we've let it know that this community just had nowhere to go. Our staff, we know, saved somebody from serious hypothermia. The person wouldn't go into the warming station because they just didn't trust to go in, and drove them around for hours with the heater on in our van. I mean, we know this is saving lives. So I think next year we've got the commitment that the state and the city will be much more planful.
The other thing I just want to highlight, just quickly, is that I don't think the general public realizes how many older adults with serious health issues are on the streets. And that it's not uncommon that someone could be discharged from a hospital these days, all through the state, including our community, to the street. So, because they're homeless and there's
Other states have
no
laws
legal-
and regulations that don't allow that. Rhode Island does not.
So we have clients that we have there, even if it's not hypothermia, like it's not 10 below zero, but they have open sores and wounds and they have no way to clean themselves.
Mhm.
And they're at risk for death
Right.
because of that.
We've had an older adult with seizure disorders having grand mal seizures in a snowbank. I mean, we've seen a lot.
Mhm.
The other thing to know isn't just the 40 unsheltered people. There's got to be, I don't want to correct me, but not just hundreds, but thousands of people that are insufficiently housed, that are living with family on a couch, or they go from one friend or relative to the other. Homeless youth that are kind of staying in places maybe that isn't safe for them because they have nowhere else to go. So this is a much bigger problem. And of course, then there's the lack of affordable housing in general. So there's many layers to this issue.
One of the
So,
I was gonna say, one of the things I think people also aren't aware of is that the unsheltered population in Newport isn't just from Newport. We've brought this, I'm from Little Compton, and we've brought this up at Little Compton events and Tiverton events, and people are like, we don't have homeless people here. Well, yeah, because how could you survive living in the Little Compton Commons on your own? Of course, you need to go somewhere that they have resources for you, and Newport is the closest place.
Yeah, but there's also a fallacy that many people think that because we've stood up services here and we have a shelter here, that people are coming from other places in the state. Virtually 90% of anybody we've touched has been from Newport County here. And they're not coming from Providence, Woonsocket. Unfortunately, the state's homeless system, it's called, requires a central coordinated entry. And they have some sort of assessment on how you're going to get a homeless person to fill out this assessment. So we have to do it with them. But they say, who's more homeless than somebody else? And so what they want to do is, when we had the motel, send somebody from Woonsocket as the priority person to come here. Well, one, they don't want to come across the bridge and come to Newport any more than we really think that people live in communities. They're connections. These folks have had jobs. They do have family. They have friends. They have people that care about them. So our secret sauce is to get people back into their lives, is to reconnect them in their communities. So this whole idea that we're one state and you can move people from one place to the other, our folks don't want to be going to an affordable house in Providence. This is their home. So that's a concept that's so important, and it's the secret sauce to getting people better, or getting them even just housed if they don't need to get into recovery. That's not their issue. It's about people need connection, and they need homes. Anyway, so I get fear because politicians say, well, you're bringing people in. That motel was filled with all these other people. You're creating a problem here. The answer was no.
I think
they're
it's,
people from our community.
Mhm.
I think it's just fascinating. Just again, I go back to the dedication that you can hear in both of your voices. But as an outsider looking in, I wouldn't think that Newport Mental Health would be in that field of helping the unsheltered. But you correlated that connection between the uncertainty of housing and mental health disorder, behavioral disorder. But I think it's great that you're showing that this is an avenue. This is a program. This is a part of who Newport Mental Health is.
I look at, and it's more than Newport Mental Health. It's the whole community mental health center system in our state. And now we are all becoming, or have become, SAMHSA recognized, the federal recognition of a certified behavioral health clinic. And that is that we have always been, and maybe haven't had the resources to articulate, we are the point of responsibility for any resident in this 86,000 plus county, that if they have a behavioral health need, that we're the place you can turn. Now, we know we can't do it all. We know that we need to do it in partnership. That's why we built with your organization a behavioral health system of care, so we can coordinate with all 10 agency providers and the Hope Recovery and the hospital and Kodak. We can't do it alone, but we can be the big door you can turn, and ultimately are responsible for making sure people are connected to the care they need. We're passionate about that. We serve people, not just Newport Mental Health, but all of the CMHCs, regardless of your ability to pay. I'm a little more fanatic than maybe some of the others, that I won't ever have a waiting list. It's not in our vocabulary here. It may be we won't be able to do as much, but when people need to turn for help, it's a mess out there, and it still is, and it's still here in Newport, but we've got to try to be the place that you can turn to 24 hours a day, 7 days a week. And I believe that. You know, it sounds, but that's why I get so worked up sometimes, because it's a hard fight. But we have good partners to do this with. So I don't want to make like we're sliced bread, and we're never going to solve these needs by ourselves. So we truly believe that we've got to do it as a system of care with the other good, not only behavioral health providers, but the MLKs and the senior centers and, you know, a whole village.
I heard you say something about driving around in your van and keeping people warm. Is that your outreach van?
No, this is we just commandeered our regular van that we shuttle people from our residential sites and group homes. That's a new program. The vans are going to be delivered when? The end of March?
The end of March, we're hoping. Fingers crossed.
That was my segue into Rhode Island.
Very nice segue. The program is called
Yep.
Rhode Island Outreach.
Yep.
And this is about getting ahead of the behavioral health crisis. It's keeping people from interfacing with our public safety, our police, so we don't criminalize folks that need care, and getting people care. And again, the same strategy we use with the homeless folks, the individuals that were unsheltered, is that we're going to be able to now, because it's grant funded, it's a pilot for the state, we're going to have a medical person, an EMT or a nurse specialist, and an engagement counselor that are going to be on the streets in the places we know folks that may need help. So we're going to stop by the Hope Recovery Center every day, and we're going to go down Broadway. We're going to know when there's an encampment or there's people, so that these folks are going to build relationships and get ahead of when the crisis is, and then take that time, whatever it is, to get folks to accept care if they need it. And we're going to be covering all of Newport County, and Bristol County will have a van, and we will. And it'll be tied into the whole state's emergency crisis system. So I think you know that if you're having a behavioral health crisis, now call 988. Don't call 911 unless there's imminent danger or a major crime going on. Call 988. And actually, we will be part of the dispatch and the response. And it isn't a one-off. See, our mobile crisis has started off we'll go out with the police if we get a 911 call or you call us in crisis. Now we know that, yes, we can help meet your immediate crisis needs and de-escalate, but now we have to connect you to care. And that may take some time to engage you and have you decide what's the options to help us. So this is all part of a system that we're trying to build.
Yeah, it's very exciting. We have 3/4 of the staff hired. The program director will be hired by the end of the month, and we should have so you should start seeing our Rio vans around. We're going to do some educational materials. We'll make sure you get some of those. But what's really exciting about this is that this model of outreach and engagement is really based on harm reduction. And harm reduction is a model that basically says what we were talking about earlier, which is nobody is bought from harm reduction. Like, whatever you bring to us, that's what we're going to work with that day, in that moment. And so we have I want to say our teams have just, it's a pretty robust training and onboarding.
And this is based on a national pilot called Cahoots, and it's been implemented in Eugene, Oregon, and then it's gone to Denver, and it has had phenomenal outcomes. It not only connects people to care that they need, it reduces arrests, because we're out there before, we're working in partnership with our police, but we're building the trust because we've worked with them through our crisis stuff for years. Let us respond first. You know, if this is imminently dangerous or this is a crime, you know, we'll call you and back us up. So they've been able to do this in Eugene, Oregon, and have 1,000 calls and only need police backup a handful of times in the course of a year. So we're modeling it that our trainers are folks that have been trained in this model out there. And so it's going to also give another path to recovery. Then the automatic thing is if somebody's in crisis or they are, you know, seriously inebriated, it is to put them in a rescue and bring them to the emergency room. Then they wait 5 hours, and if they're agitated or upset, they're strapped to a gurney until they get a clinical assessment. And then if there's a bed upstairs, there's a good chance they're going upstairs to the inpatient bed and then sign themselves up in the rotating door, or they just get walked back out the door without connection to care. It's not because the hospital isn't doing, you know, good work. It's just the system the way it was. So now we can spend the time. And the thing it brings, because many of the resources that we have, our crisis beds are in East Providence, BH Link, which is part of our Horizon network that we're part of. All the detox and rehab beds, there ain't one on the island, right? Or in Newport County. So this van will allow us, one, to use the medical person to screen you to say you're not in an emergent level of care. They'll do the vital signs. They'll make sure that this person doesn't need to be in an emergency room. And then we will spend the time to just say, hey, you know, this is not your first rodeo. Can you try an alternative? We have our other system partners that have what's called acute stabilization units. And they are like behavioral health treatment, co-occurring treatment, or inpatient level of care, but you have to consent to go there. BH Link knows where all the substance use beds are open today, real time. So we're now able to do what we couldn't. We could talk people into trying these, but then we had no way to get them there because the ambulances can't come offline for more than a half hour. That's the rule. And our other resources are often farther than that. They don't go to detox programs that add care. So now we can transport. And
so will the outreach van just be out and about and meet up with people kind of by luck, or can people call the outreach van for help?
So we're going to have it's a three-legged stool. We're going to have a schedule. We already started to partner with MLK about 3 weeks. I was starting to say earlier, in 3 weeks' time, we've had made hundreds of connections, and 10 new clients have agreed to engage in services, not just with us, but the services that are appropriate for them wherever the services are available. And we've already been able to make 3 warm handoffs. Now, these are people who have been living on the streets, who are living in poverty, and have not been able to trust enough to engage in services. We have failed them. And through this kind of work, they see that, oh, you're going to be at the MLK Center every morning for breakfast. After 3 weeks of talking to you, I now trust you. You know, everybody's time is different, right? Someone might take 3 weeks, someone might take 3 months. But so you're going to be able to see us at regular scheduled times at all of our partner agencies throughout the whole Newport County, Bristol County, East Providence. We'll respond to 988 calls.
And that comes through our BH Link call center for the whole state. But we have basically connected and staffed extra staff for them that will be our dispatchers for these vans. And then you can call our crisis line, We don't want you to have to go through 911, 988. And it's not just for people with really serious, homelessness, and it can be anybody. If you have your young adult that lives with you that's punching a hole in his bedroom, call us and we'll respond. We may bring the licensed clinician. We'll often go out with our engagement people that are specialists and calming down and de-escalating the situation and assessing, what can we do to correct that.
Yeah,
Do
absolutely.
we have a dedicated Rio line that's a special? So we're using 988 and we're using our Newport Mental Health crisis line. I'm going to give it to you.
Okay.
It's the 401, but 846-1213 is our main number. And that's what dispatches our crisis people 24 hours.
So
Rio is only going to 11 o'clock because most of the needs are, between late morning and before midnight.
I had a three-part question, but you just answered that. I wanted to know what were the time frame of the Rio van, and how long is the training, like the turnaround from being trained to being staffed? And Newport Mental Health does do all of the training, correct?
No, we have outside trainers.
Oh, outside trainers.
We have a very robust training at our agency, so I would say half the training is done by our own workforce development department, and the other half is done by specialist consultants who have been trained in the Caboose model.
Yeah, we have some folks that were managers there and trainers in Oregon that happened to move to Rhode Island, and the original company, Whitebird, is too busy and couldn't do the training because we would go right to the source. So we got the second best. We've got folks that they had trained to be our trainers. So
That's awesome.
Cool.
And the staff are, as they get onboarded, they get about 8 weeks of training, and then they stay in a coaching model until they're comfortable, because all the staff are coming in with different levels of experience, and so they stay in a coaching model until they can go out on their own. So we probably have, as the vans get finished, it's going to be perfect timing, because I think we'll have a first cohort of teams that can actually go out on the vans and be ready to work independently.
So you might ask, you got 60 vacancies in your agency. How the heck are you recruiting and have almost done filling 24 new positions? It's because we took a really creative approach. The first thing we did is we got the state to pay a living wage. So our salaries for this program, we've locked in at probably 30% higher than what we can normally afford. And we built that in because we said, you want these programs to work, you got to pay for it, right? And so that was the first secret sauce. The second was, it isn't about your credential, your degree, your license. It's about your competency and your passion, like me, that will never give up, do anything it takes. And we've hired a number of peers, but who have I would put some of these folks, their clinical skills up there with our PhDs but these are folks that have walked the walk, lived the walk, have good experience, but they may not be a licensed clinical social worker. We don't want them to commit people to a hospital. That's not our goal. So we don't need you to be a qualified mental health professional. So I think we really got a good, committed team of special people that have the heart to do this work and the competencies to be successful. So that's kind of.
Yeah, and just so the listeners know, backing this team up is always a licensed clinician, a licensed psychiatrist, administrator with many years experience, and a peer. So there's always layers and layers of backup.
And we have a licensed mobile crisis clinician available to back them up that has the relationships built with all the public safety departments in our county. We have to build the same relationships in Bristol County and East Providence because we haven't worked there ever before. So that's that we're just beginning to build those working relationships. But those people trust us because we've been working with them. You know, this program was started, I shouldn't say it, with an advocacy movement of defund the police, because its main goal was to keep people, you know, our correctional system is the #1 mental health center in the state. At the ACI, we have hundreds of people, 60% or 50% of the inmates are on a psychotropic medication or now, thank God, we're being able to do an opiate substitute there at MIT. But so part of this really came out of that movement, but we worked with an advocacy group that really fought for this, and it was called Heal Rhode Island. But they learned that we're better to bring partnerships, and this isn't about funding the police, it's working with the police. And our police departments are all in on this, that they trust us and would prefer that we use our professional behavioral health skills to de-escalate and get people the care they need. They don't want to arrest people that actually need treatment. We've got a good thing going with all of our police chiefs, and you get the leaders and their patrol captains. I think we're getting somewhere. We're still gonna have people arrested, but we gotta work at this a step at a time.
I think it's great that you have your peer team as the upfront and personal. I think that in a community where trust is the #1 thing, I think the backup team would be the team that people would walk away from. But that peer, having that peer there, someone
that's the whole idea. And the other thing is we have really been working on making this a racially and ethically diverse team. We have LGBTQ plus staff. You know this. You're from it. This is a major challenge. You know, all of us healthcare providers, we've kind of been fired by our BIPOC communities and our North End community. Not everyone, but because we really haven't been able to diversify our workforce and listen to people and be there with them in an authentic way. So we aren't there yet, but we're trying. Our goal is 50% of these staff. We're probably at what, 25, 30, 40?
We're about 30.
30.
That's
So,
great that you've noticed that and you're putting steps in place. That's awesome.
So just so our listeners can recap, they should look for you soon on out in Newport County in your outreach van. They can also
say what? White van with a blue thing that says Rio on it. It's not going to say Newport Mental Health. Here
okay. And you can also, this is going to be the wrong way, but call 988 if you have some behavioral health needs and any kind of crisis. Only crisis or just needing some?
Oh, no. If you need help, call our number. You can call in crisis, or you can call because you just want to get services and you want counseling.
You can actually
help.
walk
We cover everything from short-term, need for some outpatient therapy to help you with a situational life thing that isn't a crisis, all the way through to what we've talked about, which is more serious, prolonged needs. That number again, 846-1213. And the thing that, as being a certified behavioral health clinic, Monday through Friday, you don't need an appointment. You walk in our door at 127 Johnny Cake Hill Road. It's at the top, Middletown, the top of the Aquidneck Office Park. We're also trying to find a more centrally located center so that it's easier for people to drive in and walk in. But we believe when you need help, you got to be able to get it real time.
Awesome.
So Monday through Friday, 9 to 2, you don't even have to call. You could just walk in and we'll have someone see you.
And what about the Children's Center at 42 Valley Road? Do they have walk-in yet or not?
Yes, they have walk-in as well.
Okay. So if this is an adolescent or a child, our children's services and adolescent service and young adult services are down where the Santander Bank is at 42 Valley Road. We're in the Bagcast part of the building, and we're in the rest.
Okay.
Now, is that building, is that half of the building Newport Mental Health, or is it under a different name? So the community.
Oh, our sign is there, Newport
Okay.
Mental Health. Yep. And one other program that's there, I'm just going to throw a shout out.
Sure.
Is a specialized program for 15 to 25, 26-year-olds that are really starting, because that's when serious mental illness, adult mental illness starts to emerge, that it's a specialized intensive team just for adolescents and young adults that are really starting to emerge with serious mental health. And so that's a specialized team that really is based on some really good research. We may not be able, if you come down with bipolar illness or schizophrenia, we may not be able to cure it and eliminate it 100%, but we can give you a decent, happy, healthy life, keep you in school, keep you in work, and limit the disability that sometimes comes. It's that time to treatment that often is where all the damage is done, where the arrests happen, the trauma happens. So if we can connect you with the right services, keep you in your communities, you're going to be able to have a decent life still. So that program is very dear to my heart, because I had a son that had a full psychotic, manic episode when he went away to college freshman year. And this is the program. He's in full recovery now. And it wasn't because I knew what I was doing. I was just a dad like any other parent. But luckily, he stayed in college and he got the kind of shared decision making. He started a medication. He worked with somebody and found trial and error. I brought him to the best Yale psychiatrist because I worked and I knew every one of the world. They couldn't connect with him. They didn't work with him to have him be directing his own recovery. He worked with a nurse practitioner in the state mental health center in Hartford, Connecticut, and they found Lamictal, and it was the molecule that saved his life. So anyways, I want that for every other family.
Yep.
I'm sorry, I get carried away.
No, and
Thank you
that
for
is a
sharing
tough
your story.
time of some adolescents' lives. It's a lot of change, a lot of stuff going on. So we're glad you have that for them. Thank you for all the great things you're doing. I know we just touched on like a tiny little small part of what you're doing, but we appreciate you joining us and informing us about all these great services.
Thanks for having us.
Thank you for having us.
Thank you. So Rio, 988.
846-1213.
We're
All right. Thank you very much.
Thank you.
Thank you.
Bye.
I'm Polly, and you've just listened to Totally Preventable.
Totally preventable. Totally preventable. Totally dreadful. Totally preventable.